Well, as you know, if you've been following the channel, I turned 70 this past February. And as we age, oftentimes we take a lot of wear and tear on our bodies. And for the last 4 or 5 years, I've kind of had a little bit of an issue with my right knee. But recently, in March, it was really giving me a lot of trouble, a lot of pain. I made a decision to go in and see my doctor, I think around the 18th of March. This is now the 2nd of May. And I made a decision to step up and increase the therapy on my knee. I think what happened is last year I was doing really well. I was managing my weight down. I got down to my goal weight of 210 pounds. In late fall, I had hoped to I had set the goal that come my 70th birthday, I'd be down to 210, and I actually beat that date. But what happened is we hit the rainy season here, end of December, maybe November, December, January, February, early March, a lot of rain. So pickleball has been a primary way for me to manage my weight. That has been the physical side, the physical activity side of my weight management regime. The other one has been my diet. I was doing well along the course of the last year, cut out a lot of the junk, but for some reason when the rainy season hit, and I couldn't go out and play pickleball, we didn't have an indoor membership, so I kind of got caught up in producing videos for our other 3 YouTube channels. We have a total of 4 YouTube channels. So I was at my desk a lot, do a lot of editing, basically a couch potato at my desk, at my computer, working on videos for our other channels. So I was not getting any activity. I started eating chocolate, I started eating Ruffles potato chips, I started eating ice cream again, cheese, a lot of stuff that was not good for me, and that kind of shot my weight up quite a bit. And when I started playing pickleball again, now I'm playing with a lot more loading on my knees, my weight. The difference in my weight, was not good on my knees. So in March, I went and saw my doctor. I asked her about viscosupplementation. She talked to me about cortisone. I was more interested in hyaluronic acid. I've been following it on with some doctors on YouTube. I want to say here, I am not a doctor. Nothing here is about me offering any medical advice or anything. I'm just sharing with you what I'm going to do. So I went and saw her in March. She talked about cortisone. I said, no, I don't really want to do cortisone. I didn't have all my information together on hyaluronic acid as a treatment. I thought when I wrote my letter to her, my email about viscosupplementation, she would have made the connection with HA. So I kind of thought, okay, well, maybe Kaiser doesn't offer hyaluronic acid as a therapy for knees. So I used what she suggested, Voltaren as a topical. You put it on in the morning, you put it on at night. It was giving some relief, but still I had pain. And a lot of times it wasn't when I'm on the pickleball court. It's when I come off the pickleball court and I'm kind of at rest, or I have my leg extended when I'm trying to drive the car, is when I really felt the pain. And trying to sleep at night, it was I was tossing and turning a lot because I would feel the pain in my knees. I'm trying to put the knee in a position to get comfortable. So anyway, on Monday, this past Monday, with today being Thursday, I guess, I reached out to her and said, do you offer hyaluronic acid as a therapy at Kaiser? She checked with orthopedics and podiatry, I think is the department, and she came back and she said yes, and I'm going to refer you. She said the downside is that you're going to have to take 3 injections, 1 each week for 3 weeks versus just 1 cortisone shot. Now, in my research, again, I'm not a doctor, so you have to have these conversations with your doctor if you have any questions around this. But what I found is that, in particular for younger people, seems like hyaluronic acid is a preferred approach in younger people, because the cortisone can do some damage if you have long-term use of cortisone. So for younger people, HA has been a popular, hyaluronic acid, a popular therapy, apparently, from what I can tell, doing my research on Google. So anyway, the orthopedics and podiatry office reached out to me. I have an appointment scheduled for tomorrow morning. The pain in my knee is in this area here. I had been mitigating it over the years through wearing a sleeve, and I'll have a link to this sleeve in the video description if you're interested in a sleeve like this. This happens to be a 7mm sleeve. These work great. I've got 4 of them now. Toss them in the wash, you know, get all the sweat off and everything, and they've really stood up over the years. But I need something more, and I said, okay, I'll take injections. And so tomorrow morning, 11:30, I'll get the first of 3 injections. My expectation is there's probably maybe some swelling. Anytime you get an injection, you got to be careful about possible infection. But I wanted to share this information with you, and in particular, if you have issues with your knees, I'd sure like to find out what's been successful for you as far as a regime to try to mitigate the pain to the point that you can continue to play pickleball. See, for me, it's kind of like a, you know, double-edged sword, and, you know, pickleball helps me manage down my weight. So if I can't play pickleball, it makes it that much harder for me to drop my weight. I feel there's only so much I can do through my diet, and I'm committed to that, and I'm down 8 or 10 pounds since March 18th, trying to shed this weight. I was kind of shocked. I wasn't getting on the scale like I was every Sunday morning. Was kind of a routine, you know. Every Sunday morning, step on the scale first thing in the morning, see where you're at. I was tracking it with my Polar watch and Flow dashboard that Polar has, and I kind of stopped that for 3 or 4 months, and boy, was I shocked at how quickly my weight went up. So now I've got my diet back under control, no more Ruffles, a little bit of ice cream. I'm weaning myself off of that. No more chocolate, bring fruit back into my diet, and then we'll see what happens with these injections and see where that leaves me after 3 weeks. Again, I expect some swelling, those type of things, but I will do some follow-up videos to let you know how the therapy is progressing, whether or not it's working for me or not. I'll share that information with you, so hit the subscribe button and also the notification bell if you're interested in this content, and we'll see how we do. And again, the funny thing is, when I'm on the court playing pickleball, I don't really feel the pain as much as when I'm at rest. And again, it depends on how extended my leg is and those type of things. So we'll see how this turns out. I'm very positive about it because I don't want to quit playing pickleball. And I don't want to get a knee replacement. That's really the last thing that I want. So, all right, if you like this kind of content, please give it a thumbs up. As always, like, share, and subscribe. Other than that, I hope to see you out on the courts.